Bunions can cause a real pain point for many of us. It's not just a cosmetic issue, but it can cause significant discomfort, affect our daily lives, from the constant rubbing pressure to the potential for chronic pain. Having bunions makes it difficult to walk, stand, and even wearing your favorite shoes without pain. It's no wonder why so many people are hunting for solutions. Many of us have probably tried various remedies, from over-the-counter pain relievers to custom orthotics to toe spacers, but sometimes these just don't cut it. Oftentimes, the only option on the table is surgery. But let's get real, surgery can be scary and the recovery process isn't exactly a walk in the park. Not to mention there's always a risk of complications. So it's no wonder that people are looking for natural alternatives to bunions. The thing is, our lifestyle plays a huge role in how our feet are developed over time. Poor footwear choices, genetics, and certain repeated patterns contribute to the formation and growth of bunions. Understanding these factors can help us tackle the problem from different angles. So let's get into 7 things that you can do today to start getting some relief and solving this problem without having surgery. So we're going to talk about what bunions are. What happens is with bunions is the toes tend to start migrating to the outside. So if my finger's here, it's moving in here. The joint doesn't like being in this position, and so it causes a lot of creation out here, and because you're using your strength with the joint in this position, it'll create bone growth in through that area as well. So we need to get the joint where it's in a much better position. So the first thing that we want to do is actually look at your shoes, because if your shoes are compressing your toes in like this, that's not going to be good for your toes. You really need a wide shoe box so that you're going to have room and space for your feet. You're going to have to probably, in the short term, not wear heels or anything like that, because if you're putting pressure with it like this and it's in a flexed position because you're wearing some heels, that's also going to be big problems, a lot of pain, those kind of things. So toe box is the first thing we want to look at. The next thing we want to look at is actually how the toe moves. And a lot of times, because it's so stuck in this direction, we want to almost take it and start mobilizing it. It's a joint. Every joint has joint material, and so if we can catch this early on, we can actually start modifying where the joint goes in this. So if we can realign the joint material to where it's a little bit more centered, where it's not always pushing out this direction, that's going to help a lot. So you can mobilize the toe, and we just kind of take in the opposite direction where it's in. And so that would be the next phase that we want to look at. A lot of times, to just kind of keep it there, a lot of people will use toe spacers or braces or those kind of things, which is great because you want to keep the toe in a great position. But we find KT tape works really well, way better than the braces, way better than doing toe spacers. They tend to fall out. And so what we typically do is we cut them into little small strips like this. I probably would use 2 of them to reinforce it. You start on the inner part of that big toe, and then you'll just pull it to the outside and down. And so it'll kind of help hold it in this position. So we usually do 2 to really reinforce it. So you want the key on the KT tape is you place the ends. You don't want a lot of stretch on the ends. So you'll just kind of hold it down with not a lot of stretch. Then you'll hold that part and you're going to pull it to the side and down to kind of hold it. And then at the very end of it, again, you want to lie it where there's no stretch. If you put too much stretch on the KT tape, it's going to pull at your skin. Your skin is not going to like it. So on the ends, no stretching it, and really stretch it to really correct it. Probably 40–50% effort of really pushing it in. So that then when it kind of helps it, it's going to help hold it in this position. So once we can kind of keep it here in everyday activities, it's going to start strengthening the right muscles. And that's the next thing that we look at, is we have to look at what's the strengthening of these muscles. So a lot of times what we find is you'll have weak inverters. So when your feet go in like this and we really test it and we push it, it'll be weak in this direction because you don't have anything through here working to help with the stabilization of that toe, because it's all coming over here. You're using everything on this side to kind of help. The other thing that we find is that your toe flexors, so when you flex your toes like this and we hold them there and I pull them up, the big toe will be super weak because it's not able to work in its optimal position. If it's always over on this one side, it's not going to optimally work. So we've got to keep the toe, when we do these exercises with the KT tape, in a good position, and we'll want to start working on like toe flexors, and we can also look at toe extensors. So I would use something very, very light to work on these. Once when you tape it and you have everything in a good position, then you'll do things, and you'll want to keep it like the band close to the toe, so that is actually having to work. And you're going to pull the toe in, so not from the hip, actually from the ankle only. Pull it in and then pulling it out. So you'll be even trying to pull with that toe to pull it, yes, to get those muscles really working to help stabilize that joint. So you'll do this kind of exercise, really pushing with that toe, trying to push that toe in. Perfect, just like that. You're gonna do this like 10, 15 times, and I'd probably do it a couple times a day because these muscles are really, really, really weak. And so that's how you can work on in through here to work on getting these muscles stronger to help stabilize this area. And then again, when it's taped, you can also, where you're just gonna push your toes into the band. So you're just pushing the toes down into the band. So it's like my toes are into the band, you're just curling the toes into the band. We can just start out this way and really, again, focusing mostly on the big toe. Curl the rest of the toes, totally fine, but really focusing on that big toe. Again, you're gonna wanna do this where the KT tape is on so that everything is aligned in a really good position. And then from there, we can do a lot of different exercises and progress you as you get stronger, like things where we can work with things where you're standing and grabbing things. We can work with doing bands and standing. We can start working on pushing your toe into the ground, starting to work on getting that with a little bit of balance. So there's a lot of variations that we can do to work on getting this a little bit stronger. Now, some people can be weak up through here, so you'll do the same thing with the band where you're just going to pull the toes up towards the band. Yep, and then back down. Again, focusing on that big toe to really kind of come up. So if we notice any kind of weaknesses through there, then we're definitely going to address that as well. So when some people will have a bunion and they won't have that much pain yet. It's a yet. It eventually will come because your joint doesn't like being in positions that it's normally not supposed to be in. And if you're working it that way with everyday activities, walking, running, cycling, whatever we're doing, you're going to have an irritated joint at some point. So if that does happen, that's when shockwave comes into play, where we can really like shockwave through this area and really calm everything down, reduce the inflammation, bring blood flow back into that area. It will work like magic on top of us doing all these other things. So shockwave definitely is a thing that you can do to really help with this and heal this naturally. And then the final thing that we want to look at is if you're just frustrated, you're not really sure what to do or where to start, then getting in to see a specialist, someone that understands the body, like our office, to really go and dive deep into what's going on. We always say you have to start with mobility first, then you get into stability, and sometimes with that mobility we can do taping techniques to help with helping that mobility piece of it. And then we get into some of the strengthening things, but we can design a program specific to you and you will just get there so much faster and feel so much better, especially when we can add shockwave and things like that into the mix of our treatment. So that's the 7 things that you can do to start getting some relief now with your bunions. If you have any questions, make comments below and we'll answer those questions as quickly as we possibly can. Make sure you subscribe to our channel. We're always putting content out all the time. And if there's anything you want to learn, comment, send us a message and let us know, and we'll put a video out there for you. And share this with anyone that is dealing with bunions and is frustrated and really wants to deal with this naturally. And we'll see you next time.